Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to talk about thyroid disease, a condition that hinders the thyroid gland from producing the optimal amount of hormones. We will cover the symptoms, causes, diagnosis, treatment, and more. Keep watching until the end because there is valuable information for individuals with thyroid disease, individuals seeking information about the condition, or those who have a family member affected by it and are unsure of what steps to take. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is the thyroid? The thyroid gland is a tiny organ in the front of the neck that wraps around the windpipe, trachea. It has the shape of a butterfly, with two wide wings that wrap around the side of your throat. Throughout your body, glands produce and release substances that assist your body in performing a specific function. Your thyroid gland produces hormones that aid in the regulation of many critical bodily functions. When your thyroid isn't working properly, it might have an effect on the rest of your body. Hyperthyroidism occurs when your body produces an excessive amount of thyroid hormone. Hypothyroidism occurs and your body produces insufficient thyroid hormone. Both illnesses are dangerous and should be handled by your doctor. What exactly does the thyroid do? Your thyroid plays a crucial role in your body by releasing and managing thyroid hormones, which regulate metabolism. Metabolism is the process through which the food you consume in your body is converted into energy. This energy is used throughout your body to keep many of your body's systems functioning properly. Consider your metabolism to be a generator. It absorbs raw energy and transforms it into something more powerful. The thyroid gland regulates your metabolism with two hormones, T4, thyroxine, which includes 4 iodide atoms, and T3, triiodothyronine, which has 3 iodide atoms. The thyroid produces these two hormones, which tell the body's cells how much energy to use. When your thyroid is functioning properly, it will produce the appropriate amount of hormones to keep your metabolism running smoothly. The thyroid produces replacement hormones as the hormones are depleted. What is thyroid disease? Thyroid disease is an umbrella term for a medical problem that prevents your thyroid from producing the appropriate amount of hormones. When your thyroid produces too much thyroid hormone, your body burns through energy too quickly. This is known as hyperthyroidism. On the other hand, your thyroid may produce insufficient thyroid hormone. This is known as hypothyroidism. What factors contribute to thyroid disease? Hypothyroidism can be caused by the following conditions. Thyroiditis is an inflammation of the thyroid gland. Thyroiditis can reduce the amount of hormones produced by your thyroid. Hashimoto's thyroiditis is a painless autoimmune disorder in which the body's cells assault and damage the thyroid. Postpartum thyroiditis affects 5% to 9% of women after giving birth. It is usually a transient ailment. Iodine deficiency, the thyroid uses iodine to generate hormones. Thyroid gland dysfunction, the thyroid gland does not always function properly from birth. This affects around 1 in every 4,000 births. If the child is not treated, he or she may develop both physical and mental problems in the future. In the hospital, all babies are given a screening blood test to examine their thyroid function. Hyperthyroidism can be caused by the following conditions. Graves' disease. In this illness, the entire thyroid gland may become overactive and release an excessive amount of hormone. Nodules. Hyperthyroidism can be induced by thyroid nodules that are hyperactive. Thyroiditis. This condition might be uncomfortable or not at all. Thyroiditis causes the thyroid to release hormones that have been stored there. This can continue several weeks or months. Excess iodine. When your body has too much iodine, the mineral used to manufacture thyroid hormones, the thyroid produces more thyroid hormones than it requires. What are the most prevalent symptoms of thyroid disease? Hyperthyroidism symptoms include anxiety, impatience, having trouble sleeping, losing weight, having an enlarged thyroid gland, often known as a goiter, having tremors and physical weakness, having irregular menstrual periods or your menstrual cycle stopping, sensitive to heat, and experiencing visual issues. Hypothyroidism symptoms include tiredness, putting on weight, experience forgetfulness, having heavy and frequent menstrual cycles, having coarse and dry hair, having a hoarse voice, and having an intolerance to cold temperatures. How is thyroid disease diagnosed? Thyroid disease might be difficult to identify at times since the symptoms are similar to those of other disorders. When pregnant or aging, you may encounter symptoms similar to those associated with thyroid illness. Fortunately, there are tests that can assist determine whether your symptoms are the result of a thyroid problem. Among these tests are blood tests, imaging tests, and physical exams. The following blood tests may be performed to assess your thyroid. Thyroid-stimulating hormone, TSH, is produced in the pituitary gland and maintains the balance of thyroid hormones in the bloodstream, including T4 and T3. This is typically the first test your clinician will perform to determine thyroid hormone imbalance. Hypothyroidism is usually linked with a raised TSH level, whereas hyperthyroidism is usually associated with a low TSH level. T4, thyroxine tests for hypothyroidism and hyperthyroidism are used to monitor thyroid problem medication. Hypothyroidism is characterized by low T4 levels, and hyperthyroidism is characterized by high T4 levels. FT4, free T4, also known as free thyroxine, is a T4 detection method that eliminates the influence of proteins that naturally bind T4 and may interfere with accurate measurement. T3, free triiodothyronine tests aid in the diagnosis of hyperthyroidism and in determining the degree of hyperthyroidism. T3 levels can be low in hypothyroidism, but this test is more commonly used in the diagnosis and management of hyperthyroidism, where T3 levels are excessive. FT3, free triiodothyronine, often known as free T3, is a method of measuring T3 that removes the influence of proteins that naturally bind T3 and can interfere with correct detection. Imaging tests. In many circumstances, examining the thyroid can provide answers to several questions. A thyroid scan may be performed by your healthcare professional. This allows your provider to examine your thyroid to search for changes in size, shape, or growths, nodules. Your clinician may also employ an ultrasound imaging exam. This is a diagnostic process that sends high-frequency sound waves through bodily tissues that are inaudible to the human ear. Echoes are captured and converted into video or picture images. Examination of the physical body. A physical exam at your healthcare provider's office is another easy way to check your thyroid. This is a quick and painless exam in which your provider feels your neck for any thyroid growths or enlargement. What is the treatment for thyroid disease? The goal of your healthcare practitioner is to restore your thyroid hormone levels to normal. This can be accomplished in a variety of ways, with the precise treatment depending on the etiology of your thyroid issue. Treatment options for hyperthyroidism include antithyroid meds, methimazole and propylthiouracil. These medications prevent your thyroid from producing hormones. Radioactive iodine. This treatment destroys thyroid cells, stopping them from producing high levels of thyroid hormones. Beta blockers. These medications do not alter the amount of hormones in your body, but they do aid with symptom management. Surgery. Your healthcare professional may surgically remove your thyroid, thyroidectomy, as a more permanent type of treatment. This will prevent it from producing hormones. You will, however, require thyroid replacement hormones for the rest of your life. Treatment options for hypothyroidism include thyroid replacement therapy. This medication is a synthetic method of reintroducing thyroid hormones into your body. Levothyroxine is a regularly used medication. You may manage thyroid disease and live a normal life by taking medicine. Now, watch this video to gain some valuable tips for maintaining a healthy lifestyle. Subscribe to the channel to receive regular health tips and guidance. That's all for now, and remember to stay healthy at all times. Thank you for watching, and we'll see you next time.